Welcome, everyone. Thank you for joining me today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Dr. Ahmed is away today. Today, we are reporting an increase of 24 new cases of COVID-19 in Windsor and Essex County. 14 are close contacts of confirmed cases, 4 are community-acquired, and 6 are still being investigated. We have had 16,484 cases since the beginning of the pandemic. 250 people are active at this time, with 132 of our active cases having a variant of concern. To date, 1,718 preliminary or confirmed variants have been identified in Windsor-Essex County, with 1,593 cases having the UK variant, 4 cases having the South African variant, and 4 the Brazilian variant. 18 people are currently in the hospital and 5 people are in ICU. Our community has lost 426 people to COVID. There are currently 11 active outbreaks in Windsor and Essex County, 10 workplaces, and 1 community outbreak. Now for the vaccine update. 261,897 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 238,424 people have received at least 1 dose. Overall, 69.2% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID vaccine. Residents of Windsor-Essex County 12 years of age and older are able to book their vaccine appointment at one of our mass vaccination sites. Please book at wevax.ca or by calling 226-773-2200. People are also able to receive their first vaccine at participating pharmacies and primary care providers. 27 area pharmacies are currently offering second doses of AstraZeneca to those people who received their first dose March 10th to March 19th. Please visit our website at wechew.org for further information. And now for our weekly Epi Summary, which will be delivered by our epidemiologist, Ramsey D'Souza.
Good morning, everyone. Thank you for joining me for this week's epidemiological presentation. I'll be stepping in for Dr. Ahmed. So let's begin. For the first half of this presentation, we'll talk about our cases locally here in Windsor-Essex and look at comparisons in the rest of Ontario. Overall, in the third wave, we are now seeing a dramatic decrease in cases across the province. The cases so far in the past couple of days have been in the low 1000s. The last time we were here in Ontario was in the early stages of March. Now moving on to our case counts and our 7-day average, we are seeing a slow decline of our cases as well. Now comparing the two 7-day averages side by side, we see that in Ontario, we've seen a much steeper decrease in cases over the past few days and weeks, whereas in Windsor-Essex, it hasn't been so much, but yet we're still observing a decline. Now looking at our week-to-week case rates in Windsor-Essex, in the past week, which is week 20, we have seen a decrease in our cases. For this week, week 20, our case rate is 62.6 cases per 100,000 population. Looking at the last 7 days, our case rate is 46.8 cases per 100,000 population. This is a huge decrease from what we've seen last week. When we compare our week-to-week case rates in Ontario and the other regions of the Southwest, once again, we see what we've seen in the previous slides. We've seen a dramatic decrease across the province and in the Southwest region, and our rates have also remained lower than the other regions. This slide looks at our wastewater surveillance. In the past week or so, our wastewater data has been higher than what we've observed in the past few weeks. Now moving on to our percent positivity, this figure looks at all of our unique tests and conducted in Windsor-Essex. In total, there were 350,045 tests that were completed as of May 22nd. This is a complete week ending on Saturday. For the week ending on May 22nd, our percent positivity was 5.7%. This has increased from last week where we were roughly at about 5.1%. Last week, approximately 4,811 tests were completed. When we look at the most recent 7 days worth of results, we see that in Windsor-Essex, we have the 12th highest percent positivity in all of Ontario, and we also sit below the provincial average. The provincial average is at 6.3%, whereas we are at 5.2%. Breaking this down by age group, we see that the highest percent positivity is among those 0 to 17 years of age, followed by those 18 to 34 years of age. In our senior population, the percent positivity has remained fairly low in this third wave. When we look at our school-age population once again, and we break that down a bit further, we see that the percent positivity in our high school age students is increasing once again, while those among the elementary school age is decreasing. This graph looks at the epi curve among school-age children. Our current 7-day average is 4.3 cases per day, which is lower compared to what we were seeing last week. This time last week, we were seeing about 5.1 cases per day for school-age children. Comparing our school age and 7-day average to our overall 7-day average, we've seen some fluctuations among our school age 7-day average, but a slow decline in our overall 7-day average. Now, when we look at our cumulative rates across the province, Windsor-Essex continues to have the 4th highest rate, and our case rates are higher than the province. When we focus in on all of May 2021 by municipality, Windsor continues to have the highest case rate, followed by the town of Essex and then LaSalle. When we strictly look at the number of cases by municipality, 74% of our cases come from the city of Windsor in the past 30 days. Now, when we look at the past 7 days, this goes up even more for Windsor, when we're just under 80% for the city, and all the other municipalities make up less than 5% each of our cases. Here we look at the overall cases by age and sex and what they look like in the past 2 weeks. Looking overall and at the past 2 weeks, our cases are higher in the 0 to 29 age group, which is about 52%, while we are seeing less and less cases in the 40 and over age group. This can be attributed to the vaccine rollout to our 40 plus population. Individuals below 40 years of age have only recently received or have had access to the vaccine. Our more recent coverage rates for the 20 to 29 years of age is in the low 40%. This slide looks at our cases from May onwards in terms of how they acquired COVID-19. We see that it is predominantly due to household contact, the orange bar, followed by acquisition in the community, where a source could not be identified, which is the red bar, and by acquisition by a close contact that's not in one's household, which is the green bar. We see very little cases tied to outbreaks or that are travel related. So looking at our cases for all of May to present, in terms of how they acquired COVID-19, approximately 38% of our cases acquired COVID-19 from the household contacts. Almost 36% of cases had an unknown source, and about 17% of cases acquired COVID-19 from a close contact not found in their household. Moving to variants of concern, since late March, we have seen a dramatic increase in the number of cases with variants of concern. Looking at the percentage of cases that are variants by day, it follows the trends we see in the previous slide, where proportion of cases that have variants have increased since late March. Generally speaking, since April, at least 40% of our cases have been due to variants of concern. Please note that due to delay in testing of variants, more recent numbers are considered preliminary and could be higher. Now moving on to our hospitalizations of COVID-19 cases. When we look at our hospitalizations in Ontario and Windsor-Essex, we see that across the board, hospitalizations are decreasing. When interpreting this slide, please note that COVID-19 hospitalization in Windsor-Essex includes all patients from Windsor-Essex and also outside of Windsor-Essex. We see a similar trend when we look at COVID-19 cases in our ICU. In both the province and locally in Windsor-Essex, we are seeing a decrease in COVID-19 cases in our ICU. Looking at our age and sex breakdown of our COVID-19 deaths in our community, this has remained fairly unchanged since last time. The majority of our cases that have passed away have been within the 80 plus years of age, and typically females and males have an even distribution in terms of who has passed away from COVID-19. Our overall case fatality rate remains unchanged at 2.6%, and is higher to that of what we're seeing in Ontario, which is at 1.7%. Our case fatality rate in long-term care and retirement homes is, though, lower than what we're seeing in the province. Now, revisiting our doubling time, in Ontario and Canada, in the past couple of days to about a week or so, we are seeing positive signs where the doubling time is trending upwards. This is true for Windsor-Essex, Ontario, and Canada. Our current doubling time, though, is trending better than what we're seeing in Ontario and Canada. Our most recent R0 is 0.73. This has decreased from last week, where we were at 1.01. When the R0 is less than 1, each existing infection leads to less than one new infection. This signals that our cases are decreasing in our region. Now moving on to COVID-19 vaccine status in Windsor-Essex. Before we move on to our local stats, this slide looks at our COVID-19 coverage rates in Canada in comparison to other regions across the world. Currently, Canada has a better coverage rate of individuals with at least one dose of a vaccine and is on track to surpass the UK. We are doing much better than Germany, Italy, and France. This slide gives us a breakdown of doses that were administered over time. Most second doses were administered in February, and currently we are seeing second doses administered to those who are eligible to receive it. In some days in the past week or so, we have been administering close to 5,000 doses. This slide looks at the same data, but also adds the 7-day average of doses administered to Windsor-Essex residents. Currently, we are administering about 3,700 doses daily to Windsor-Essex residents on average. Now, looking at our coverage rate by age group and overall, we see that our overall coverage rate of at least one dose is 53.6% in Windsor-Essex. The 50 plus age group has an overall coverage rate of 80.9%. And the lowest coverage rate are those in the 20 to 24 years of age at 41.2%. This slide looks at the percentage coverage by age group and week of at least one dose. Our coverage rate in our senior population that are 60 plus has saturated. We are seeing a plateau too in our 50 to 59 year age group, while we are seeing a sharp increase among the 12 to 17 years of age and 18 to 19 years of age group. Focusing on our hotspots and overall, our hotspots have a coverage rate of 49.3%, which is lower than what we're seeing in our entire region of 53.6%. Some hotspots have a higher coverage rate, such as the N9Y hotspot, while the N9Y hotspot, while the N9A has the lowest coverage rate at 42.8%. Looking at where Windsor-Essex residents went to receive their dose, the majority of residents went to a hospital-operated clinic, followed by a mass immunization clinic operated by the health unit, and then a pharmacy. This slide looks at the proportion of vaccines administered to Windsor-Essex residents in terms of clinic type. 39% of residents receive their vaccines at a hospital-run clinic, 28% at a public health clinic, and 17% at a pharmacy. When we look at the specific number of vaccines given to our residents, the majority of vaccines administered have been the Pfizer vaccine. And this makes up about 69% of the vaccines administered to our residents locally. Looking at the daily dose administered by vaccine type, in recent days we are seeing second doses of AstraZeneca given to our residents. Now, switching gears a little bit, and moving on to looking at vaccine breakthrough cases. This is where a person who has been immunized becomes sick with COVID. Vaccine breakthrough can be defined in 3 ways according to Public Health Ontario. Not yet protected is where a case has received their first dose less than 14 days before becoming infected with COVID. Partially protected is when a case has received their first dose for more than 14 days before being affected by COVID. And fully protected is where a case receives their second dose of vaccine 7 days or more before a COVID-19 infection. When we break this down, about 47% of cases develop COVID-19 before they were fully immunized within 14 days. In other words, they had COVID, and within 14 days of their immunization. Another 46% got COVID-19 after 14 days of the first dose, and only 7% of cases were fully vaccinated. Looking at cases since December 1st up to May 21st, 96.7% of cases were not vaccinated, and only 3.1% of vaccinated cases were identified, and 0.2% of cases were fully protected, which means they have received both first and second doses. Looking at the vaccinated cases, which includes our fully protected cases, this makes up 387 cases that were immunized. Now, looking at symptoms among individuals that were vaccinated, 70.4% of fully immunized cases were asymptomatic. In vaccinated cases, which includes one dose, at least one dose, this comes up to 39%. In summary, the case rates in Windsor-Essex County have decreased this past week. Our doubling time has also improved across the board in Windsor-Essex, Ontario, and Canada. COVID-19 hospitalizations and ICU have decreased in Ontario and Windsor-Essex. Wastewater surveillance data, though, has increased this past week. However, our coverage rate for COVID-19 vaccine has gone up to 53.6% from 48.3% from last week. Now, looking at our monitoring indicators, for our most recent completed week, our case rate is 62.6% per 100,000, whereas in the most recent 7 days, it sits at 46.8 cases per 100,000 population. Our percent positivity for the full week is 5.7%, but in the most recent 7 days, it's 5.2%. Our most recent R naught effective is 0.73, signaling a decrease of cases in our region. Thank you.
We'll now take questions from the media. Today we'll start with CTV.
Good morning. We are noticing still on VaxFinders that there's a lot of appointments available for Pfizer and Moderna at mass vaccination clinics. What can you tell us about that?
So you're correct. There's availability to get your vaccine. So at our mass vaccination clinics, we are doing first doses. So the target is 12 years of age and older. And it seems like people are getting their first doses, whether it's at a pharmacy, primary care provider, or at a vaccination clinic. So it looks like we're reaching that point where people, the people that want the vaccine are able to receive the vaccine. So we encourage people to continue. The 12 to 17-year-old group has been our focus this week, and that will continue into next week. But there is availability. And that's why we did take that step to, beef up our wait list for those 70 years of age and older, because we are seeing spaces available, and a space is a dose. And so we began some second, the wait list for second doses of those that received their vaccine in May and are older than 70. So you will see a lot of the availability if there are 100 spots available, and also people not showing up because they've received their vaccine. We'll be pulling from these wait lists and start the second doses.
So do you see this as more of a positive thing versus hesitancy, or?
It's probably a little bit of both as we move down the age group. Overall, our the vaccine rates and the coverage in Windsor-Essex is very good. You can see as we targeted each of the age groups and have moved down that there's significant coverage in many of those groups. As we're getting to the lower age group, we haven't had, they haven't had as much time to get the vaccine, so we hope that all increases. They also may be the people that are working and not able to get to the vaccine site and need to kind of plan it a little bit, where others were more readily available and accessible. But we'll keep monitoring that. So we were anticipating at some point we would be finishing first doses in our community, that anyone who wanted a first dose will, it'll come to that point where we would start seeing those vacancies in our mass clinics. And we also know that through our primary care providers that they're seeing that as well. So people are accessing their first dose, and while people will always trickle in for first doses, we're probably at a point where there's not this thousands and thousands that are trying to get it and don't have access. We do have points of access, and all of our community partners and our mass sites are still ready to vaccinate people for, with their first dose.
Okay, there are a few reports going on across the province that there are outbreaks at nursing homes, and those are being due to unvaccinated staff. Since the majority of those residents in those long-term care homes here in Windsor-Essex have been vaccinated, do we know of any outbreaks that have happened since due to staff not being vaccinated, or does that not apply to any location here in Windsor-Essex?
Well, I did check, and I know that was yesterday a question about our last outbreak, and it was in early May. So it's just everything. It seems like it was for a longer time ago, but every outbreak's a little bit different, and all of the, with the testing and with the COVID screening, it could start with a staff person. And I don't know specifically, every home is so different based on their coverage. And as Ramsey just reported, people can be partially vaccinated and still be a case. But overall, we know the residents in long-term care homes are, for the most part, almost entirely, they have really good coverage rates. So the staff coverage rates aren't as high in all of the long-term care and retirement homes. So staff can continue to bring this into the home. But I can't specifically, comment on any one home because I don't know the circumstances. And right now we don't have an outbreak. But every outbreak gets investigated, and the definition really is, a positive case with transmission occurring, and we are managing everything very quickly. Right now, we have the capacity and ability to work with the homes quickly to contain it and minimize or, decrease any kind of spread. So that remains our focus. And of course, vaccination, as Ramsey showed, it really is helping to prevent the symptomatic severity of the disease and hospitalizations and deaths. So we, that's our primary public health measure at this point, considering everything else, masking, distancing, but vaccinations have always, are showing great promise in our area, and especially in the long-term care homes.
Okay, and one last question. There was an article in the Globe and Mail. One expert was suggesting that we are at the point in this pandemic where we should stop cleaning the groceries when we come home from the grocery store, because all of those things, like all of those wipes, contribute more to a negative impact on the environment. Should people still be taking all of those intense precautionary measures versus taking the environment into consideration, or what are your thoughts?
So when you're saying cleaning, like I'm sorry, are cleaning the fruits and vegetables, or what are they cleaning?
Like using like a clean, you know, if you have a bag of chips and you're using basically those sanitation wipes, those Lysol wipes to wipe everything down. He's saying, you know, we don't have to go that intense of what we did at the beginning because of where we are in the pandemic, and that is being more harmful than good.
So
You're not necessarily putting your fruits and vegetables in the sink and washing it with soap and water.
oh, okay.
More like the wipes.
Right, okay, wiping down everything. I'd have to have our staff look at what Public Health Ontario has determined, because all of that, those kind of studies are being, they are being looked at. So again, I would have to defer to, a more credible source that is looking at particular practices and when they are, no longer necessary, or that kind of that kind of guidance. I feel like I just don't have enough information to be able to, credibly speak about that.
Okay, but do you still suggest that people basically clean all of their stuff when they come home from the grocery store, just like we've been doing?
Well, right now, all the measures are still in place. So and I think you're right, the sanitization and disinfection, those are measures that have been throughout the pandemic, and cleaning surfaces, we continue to do that here. And on anything that we're touching where there's the ability that someone else, or the possibility that someone else may have touched it and there's transmission, but we know that the transmission with COVID is primarily respiratory and not necessarily, by touch. So I would say those measures are still in place to the extent to which people are doing them. I can't really comment on, the aggressiveness of that, but we would still be promoting all of that, the disinfection, the sanitation, the wiping down, especially in, as we talked about, long-term care homes and our own homes. If you're going out and bringing anything back into your house, those measures are still all in place at this time.
Okay, thank you.
Any questions from CBC?
Yes, good morning. My question is for Ramsey. Please correct me if I'm wrong, but I think this is the biggest weekly decrease in the incidence rate that we've seen in some time, possibly since the start of the shutdown period. Do you have any insight into why we saw such a sharp decrease in the last week or so, given that we've been in the same shutdown and set of rules since April? Do you think it suggests we've reached some sort of critical mass on vaccine protection?
Well, we're getting closer and closer, and it is also now open up to most of our age groups as well. So that accompanied with what we're seeing with our measures as well, I think things are improving. We did start vaccinating a lot earlier than a lot of other regions where there isn't a lot of care, and in our homes as well, and also with our pilot with AstraZeneca. So earlier this year as well. So all of that has played an effect, and our residents are doing a great job in terms of following measures too. So all that together has not only brought about a milder third wave for us, but we're now seeing the benefits of it as well.
Thank you very much. And Teresa, I have a question for you as well. Switching gears a bit, is the Health Unit doing any ongoing education or outreach on COVID-19 vaccines or COVID in general for low German-speaking community?
I don't believe we're doing anything specific for the low German community. We do have a group working on different languages and assessing the barriers for people to get vaccinated. So they would be included in that overall strategy. So again, it's trying to work across those hotspot communities and be able to give more information and in different languages, and also engage people more. So I know that is happening with some of our partners and our health units involved as well. And I think you'll see that as the mass vaccination sites become, as they've reached the people that they can. We will continue to target other groups where vaccination rates are lower and that need more more engagement from our health unit, and to answer any questions, work with their community leaders. So that would be a group that we're aware of, and we'll continue to advocate for vaccine and help get people vaccinated and answer any questions and deal with any issues they may have.
Thanks very much.
Any questions from Blackburn?
Yes, good morning, Teresa. Just to follow up on some of Stephanie's questions regarding the availability of appointments. At what point would you say that it's time to start scheduling those second doses when you're seeing the openings at the different mass vaccination sites? There's been some suggestion that maybe the timeline could go from 16 weeks to 12 weeks. Do you have the authority to make that move, or do you have to wait for guidance from the province?
Well, we really do align with the provincial direction, and Dr. Ahmed is in conversations with the Ministry of Health as well, because we even moving a wait list to give second doses is not something we would just do without the evidence to show that yes, we're saturating the first doses, and this is how we want to continue to move forward. But in answer to your question, yes, we're ready for to do second doses. We think we have the capacity and the ability to move forward. We know what our vaccine allotment is. It's using our vaccine to completely use all of our supply, and if first doses are, if the saturation is, we're starting to see that, then let's use those second doses. But we do have to wait for we have to have direction and guidance from the ministry to move forward completely. But we are planning and waiting. We know it's got to be soon based on what we're seeing in Windsor-Essex County.
I guess Ford is expected to make an announcement this morning at 10:30. Have you had any indication that might be the announcement, or, I mean, you're not really notified? I know sometimes you're surprised by things that they announce as well.
Well, we will all listen with great interest to see what Premier Ford has to share, but stay tuned, I guess. There's a lot going on, as always, throughout the whole pandemic, so we look forward to hearing the announcement.
And finally, I know every day you announce the overall vaccine coverage and then the adult coverage. And I think the adult coverage is what people are really looking at, because that's what are the indicators for the different phases. For the second phase, I know we're not in the first phase yet, but we've reached that 60% overall coverage for adults. The second phase looks at the doses. On the website, it says 4.9% of the overall population for second doses. Do you know what that percentage is for when just looking at adults?
Okay, I'm wondering if this is a Ramsey question, because I'm not sure. I haven't looked at the...
We haven't taken a look at that just yet. The plan is once second doses are fully in swing here, then we'll look to have that additional breakdown across all of our adult age groups.
Okay, thank you.
Any questions from CFTV?
Not at this time, thank you.
Any questions from the Windsor Star?
Yes, good morning to you both. Teresa, just to be clear, you need the go-ahead from the ministry before opening up appointments to second doses more fully, but you don't need the guidance from them to do it in a wait list basis?
We do have those conversations, so we're not doing it without the knowledge of the ministry. The wait list I'm talking about, but generally we're following all of the, the direction from the province, from the Ministry of Health. And so the conversation, the wait list moving forward was based, on conversations with Dr. Ahmed, so, and the ministry. So, it's not across every area in the province. It's really specific to what we were seeing locally. So that's why we were able to move forward. But I don't want people thinking we did that in isolation as a separate kind of, like we're just going to do this without notifying the ministry. So we're really working in sync and aligned with the ministry through this vaccine rollout for sure.
You talk about you need evidence, you need the indicators that we've reached the saturation point for moving on with the second dose appointments. Do you see would there be a sort of transition where you would continue to do first appointments for some while doing second dose appointments for others, or do you think that it would be a major flip where it would be primarily a second dose rollout?
Well, this is what I see, is that we should really actively work to get everyone who wants a first dose vaccinated through any means that they can get vaccinated, whether it be a mass vaccination clinic, a pharmacy, or a primary care provider. So give people the ability to continue to get first doses, because as you know, those younger age groups, we don't have the coverage yet. So we do know, there's improvement there. So offer the first doses, and at some point, and that's why it's important if there's the ability to do the shortened second dose interval rather than the 4 months, then I can see a transition from first doses to second doses in our mass sites to finish up all the second doses and have the existing channels through pharmacy and primary care to continue to do any people that remain for first doses, where you don't need a mass site to do these great big volumes. I don't think we're quite there yet, because we do have the 12 to 17-year-old age group. I think we'll see a lot more uptake next week. We have a more emphasis and information is going to the parents, and but I would say in June, we have to look at that. Where is that point where we, say, okay, the majority of our first doses are, done. Let's just concentrate all of our efforts on getting people vaccinated with second doses and, still giving options in our community. But the province and locally, we have been onboarding pharmacies and our primary care providers almost from the beginning, not in tremendous amounts, but you can see through Ramsey's presentation that the pharmacies have been a great distribution site, and they're a good access point for people to get first doses. Primary care providers as well. People want to go to their family physician or nurse practitioner for COVID vaccines. So there's more access in our community. I think overall, all of our healthcare partners have done a great job, and I think it's great progress.
Thank you, Teresa. And separately for Ramsey, thank you for your presentation. You talked about the infection rate among vaccinated residents. Does our data line up with provincial data for vaccinated individuals contracting COVID-19?
I think it's too early for us to do that. We do have a smaller sample size, so our numbers are not as robust as what we've seen in the province. The province's numbers are lower compared to ours, but even still, we are seeing a lot less cases who have been vaccinated. So it's still great news all around.
Okay, thank you.
Any questions from AMA 100?
Hi, good morning. I'm not sure if this would be for Teresa or Ramsey.
But I'm just looking at, from the presentation, the coverage in hotspots within Windsor-Essex, and a number of them are below 50%. Are you happy with the rate of vaccinations that have taken place in the hotspots, or would you consider this kind of low?
I can start. I would say we would want to increase the hotspots. I'm looking at that slide right now, and we've talked before about herd immunity, and so again, getting as many people as possible vaccinated, and we'll see. Hopefully, these numbers will increase because with our 12 to 17-year-old strategy, we know there are families in these hotspots, and we do have access through pharmacies and through the vaccination clinics and primary care to continue to vaccinate. And we are asking people that, you know, if you have a child that's 12 years of age and older, and you yourself as the parent or guardian haven't been immunized, come to a site or a pharmacy and a physician and get vaccinated, everyone. So maybe this will be the ability, the time for people to, you know, to go and get vaccinated together if there's been some delay in doing that. We also have community partners that are doing outreach to these areas to answer any questions, provide information. Again, make sure that information is provided in the languages that they understand and speak so that they can actually be informed about what we're offering, and you know, make sure any of their questions are answered. So work continues to be focused on hotspot areas, and there are other areas in Windsor as well that you know, have coverage rates that are, you know, could be improved. So I would say everyone needs to have that vaccine discussion and get vaccinated. We have good vaccines, great vaccines, and I think Ramsey's presentation, while it is early, it does show that vaccine full coverage is working. So I think getting everyone vaccinated first and then second doses will really help our community, and we will continue to target all of these hotspots and across Windsor-Essex County.
And still sticking with the hotspots, I know you mentioned language barriers in there. I know that vulnerable populations or perhaps low-income portions of the city are potentially in some of these hotspots. So you said that, you know, work continues. So specifically, what things are being done to try to reach out to these populations to make sure that they are educated about the vaccine and know what their options are in terms of how to book or how to go get a vaccine if they want one?
So we, our area received funding specifically for high priority communities. And through that funding, we have, which is being led by CMHA and working with the health unit and other partners, such as the YMCA, Multicultural Council, and others. And so they are working to target people living in the hotspots and addressing the barriers for people in the hotspots and also in other, you know, across Windsor and Essex County. And so the work they are doing is they have direct outreach and direct access to people. Our community health center, we know that they are situated in the downtown area, and they are interacting with people and seeing patients and clients every day. So all of that work collectively is happening, and they were instrumental in helping facilitate the communication when we had the pop-up clinic at St. Angela Church Hall and then again at Mackenzie Hall. And so that you know, that work is probably the most significant. And as our nurses continue to do case and contact management with any of the cases, if they are identifying any barriers, we are working with them, our municipal partners, and the high priority communities group to make sure we share that and help people address any issues. So we're working as much as we can to support people and to engage them and identify what is occurring, you know, what are some of their barriers. And we also just want to give another shout out to the Chamber of Commerce for their initiative, even with the transportation. Transportation for people living in hotspots to attend a vaccine clinic is still in place. Free transportation there and back through one of the the taxi service. City of Windsor offering the Transit Windsor. So that's a great initiative, and we hope people will use it. If transportation is a barrier, we hope we've removed that problem for them. And if needing someone to explain something in their language, if that has been a barrier, we hope that we continue to remove that problem by increasing our information in different languages and having partners reach out to them that work with them on every day. So we can always do better, but I think we are making some headway. So hopefully those numbers will improve as a result of some of this outreach.
Okay, thank you.
Any additional questions from CTV?
Yeah, so the embargo has been lifted regarding 80 plus residents. They are allowed to book an appointment for their second dose starting Monday. Is that going to be the case as well in Windsor-Essex?
So when you're saying the embargo's been lifted, like it's there?
Yeah, sorry, I think it's the release about what they are talking about today. Sorry, I'm just looking at a super quick email. And it says for those in Ontario, 80 plus, the group will be eligible to book second doses as of Monday. Then we'll go down to 70 to 79. That age bracket will then be able to book starting the week of June 14th.
Well, all I can tell you is that
are we looking at?
We're ready and
sorry.
We're ready and willing to move forward when we get the go-ahead from the province or from the ministry.
Okay, thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from CFTV?
No, thank you.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
Yeah, I've got about 10 more questions. Just joking. Have a good weekend.
Have a great weekend, everyone.
Thank you.